in the area of hormone receptor positive cancers, there has also been several advances really over the last couple of years. Of course, the cyclin-dependent kinase inhibitors, CDK4/6 inhibitors, have really become now staples of first-line therapy. And that trend of that began 5 years ago now with the approval of palbociclib, and then shortly after that, ribociclib and abemaciclib, and they all show roughly the same doubling of progression-free survival. And in the case of ribociclib and abemaciclib, we now see survival differences both in the first-line setting in particular, but also in the second-line setting. And the use of these agents is now being tested in other ways as well. For example, in HER2 positive and hormone receptor positive cancers, there are studies now that are looking at CDK inhibitors in this group of patients. Even in triple negative patients who have intact sensitivity of this pathway as defined by active retinoblastoma protein, which is necessary for CDK4/6 inhibitors to work. So we're still trying to learn which groups of other patients outside the area of hormone receptor positive can be treated, and how to define which ones are negative and how to use that information to overcome positivity or negativity. There also have been a couple of trials comparing this to first-line chemotherapy with capecitabine that have actually shown that the CDK inhibitors actually outperform chemotherapy in that setting. The one bit of disappointing news that has come out is that in the adjuvant trials, and there are all three of these drugs are being tested in the adjuvant setting. The first one to really get off the ground was the PALACE study, which was looking at palbociclib for 2 years compared to a placebo in high-risk patients with hormone receptor positive, HER2 negative early stage breast cancer. And that trial was recently stopped because the interim analysis of that trial showed that the differences between the two arms were unlikely to be positive based on the point at which they were being studied or analyzed. So that is a bit of a disappointment. I think most of us predicted that these trials would be positive, and we're going to have to go back to the drawing board on that group of patients.